Hello, everyone. Hi again. I'm very excited to be back for the next panel discussion where we're going to be discussing prevention strategies for infectious diseases. My name is Rory O'Neill. I'm a health reporter at POLITICO. You can follow the summit on X. Just use the hashtag PoliticoHealthcare. We're talking about prevention for infectious diseases. The world is increasingly vulnerable to them. As we speak, there's a major outbreak of Mpox in Central Africa. Rwanda has been battling an outbreak of the deadly Marburg virus, and scientists are increasingly concerned at the evolution of bird flu, which has turned up in cattle and pigs in the US. The climate crisis, meanwhile, means Europe has new infectious diseases to worry about, with dengue cases surging this year. And despite these growing threats, we're still grappling with vaccine hesitancy, vaccine skepticism, and the rise of political leaders who are open about their mistrust of mainstream science. We know a lot of these challenges are getting worse, so what kind of a position are we in, and what can we do to prevent health crises? Joining me to help work through some of these issues, we have Angelo Fasce, who's a research fellow at the University of Coimbra, member of the JITSUVAX project, combating misinformation in the age of COVID, which is funded by the EU Horizon 2020 project. We have Marjolein Sonema, Director General for Health at the Ministry of Health, Welfare and Sport in the Netherlands. We have Tokunbo Soyeme, Senior Director for Global Medical Affairs for HIV at Gilead. And we have Dr. Wolfgang Philipp, the Chief Scientist Officer at HERA, the European Health Emergency Preparedness and Response Authority. You're all very welcome. Thank you. I'm going to start off with a question for everybody. Wolfgang, I'll probably start with you at the end and work back to me. We're facing so many threats from infectious diseases, and when we think about prevention strategies, there's so many individual components to unpack there. There's vaccination strategies, there's R&D, innovation, threat detection. Far too much for us to cover exhaustively in this session, but we'll hopefully get into as many of them as we can. But I'm going to ask each of you, starting with you, Wolfgang, what's one element of prevention strategy that you think we're really not getting right at the moment and where we need to improve?
That's a very complicated question at the end of the day. No, I think you mentioned already a couple of components which are very important for prevention strategies when it comes to infectious diseases. I mean, public health interventions, preparedness measures in general, international cooperation, that is something where we certainly need to do more. I think that is perhaps one of the parts where there is much room for improvement and also for benefits in digging deeper there. And that's not just about early detection or surveillance or vaccination programs that could be aligned, about communication that could be streamlined or that need to be streamlined. We are certainly going to talk about this later when we come to vaccine hesitancy. But at the end of the day, I think there's so many different entities in this global health security architecture that goes beyond health security, obviously. And here we have a huge potential to intensify the collaboration and really cooperate in a way to make sure that we have early detection as early as possible, that we know how to react to it, and that we have the means to do so. And that comes then obviously with what was mentioned in the panel before, investments into research to countermeasures, but also investments into the people that the information is right at the end of the day. So I would say for me the number one here to start off with would be international collaboration and cooperation in that area.
Okay, great, thank you. Tokunbo, what do you think?
Thank you so much. First of all, I would like to say it's a real opportunity and honor that we have the ability to be here, that industry is able to contribute to this conversation, so really appreciate that. Of course, every single infectious disease requires a tailored approach for us to be able to deliver holistic preventative services. We at Gilead Sciences, we have a proven track record of not only developing transformational medicines, but also really committing to the process by which we can ensure that prevention mechanisms specifically are able to reach the communities that need them most. So I would like to, for a second, just really focus on HIV, given that that's one of the biggest epidemics that has really impacted in recent history. And that's an area where definitely there's some work to be done. And while we've made progress in the last 4 decades, of course, some of the recent data we're beginning to see suggests that there's still some work to be done, and that all of those interventions and approaches and investment that brought us here may not necessarily get us to 2030, that renewed investment, renewed effort, renewed concentration and political action will be required. If I can take a minute to just give some numbers to substantiate that. Across the European Union, the member states, we have 780,000 people living today with HIV. That's over 750,000. And in 2022 alone, we have over 23,000 new infections. HIV is a treatable but preventable infection. So that's 223,000 new infections, individuals who will now live their whole lifetime with HIV. That is healthcare resource utilization. That's drawing on government and investment, of course, over the course of the time they're living with HIV. So for today, I would like, as we carry on with the conversation, to focus on really how do we ensure that the tools that we already have to help us to prevent HIV, how can we ensure that we're deploying those maximally and that they can reach the individuals and populations that need them most.
Great, thank you. And we're going to be coming back to that, I hope. Marilyn, what do you think, what's one area of prevention strategies that you think we need to do better on?
Well, thank you first for being here. It's an honor and also a pleasure to be here and to discuss this very important topic. And when you asked the question, which number one thing you would like to change, I was thinking, I think COVID learned us that over the whole part, all the different subjects need to be improved. What we had when we started on COVID wasn't enough, wasn't good enough. So I would like to mention a few elements of effective strategies seen from the Dutch point of view. First, coordination, which also has been mentioned by you, Mr. Wolfgang. And this has to be done on international level, as you mentioned, but also very important on the local level. Local public health institutes are very important in tailoring the prevention to the local needs. How do we reach the people? I think a second element, which also has been mentioned, is early detection and rapid response. Only if we do that, we can combat as soon as possible. We've seen that with monkeypox in the Netherlands. As soon as we got it, we acted very quickly, we responded quickly, which helped us a lot. And some examples where we have been working on early detection and rapid response is in the Netherlands. We improved our system of wastewater management during COVID times. We made a Corona Melder app, which is a digital COVID tracking tool. I think more countries had this. And also the PrEP, that's also early detection and rapid response. We provide PrEP medication for prevention. So these are examples on how you can work on that. And I very much agree with you that also the figures in the Netherlands are getting higher, are rising, so we need to do more. And finally, a big lesson we learned in the Netherlands during COVID is that we need a unified vaccination registration system. We didn't have that. We had a lot of problem. We had to put a lot of effort to get grips of how the vaccination rate, but also on the side effects of vaccinations, and it was also difficult to do research since we didn't have the figures well enough. So this really needs to be developed. We are developing that right now, and I think it's also good to go a step beyond, and we also develop a standardized system on EU level, for example, that will enable us to have a better comparison of vaccination rates over Europe.
Super.
Or even maybe worldwide.
Okay, great.
So these are some elements.
Yeah, plenty for us to get into as the conversation goes on. Thank you. Finally, Angelo, what's one area of prevention that you're particularly concerned with?
Yeah, well, I think something very important. I mean, vaccine hesitancy or antibiotic misuse have been an issue since the very beginning of the deployment of these interventions of preventive medicine. But something very important is to understand the psychological drivers of vaccine-hesitant people. Why people are rejecting vaccines. And for that, of course, we need to conduct research, but we also need to train physicians and healthcare professionals to have psychologically informed conversations with the patients, for them to tailor the message to the psychological profile of the patient and to understand why is the patient so hesitant or rejecting, because many patients are fence-sitters. They just need to have the correct conversation and to solve their concerns in an empathetic manner. Something that has been happening in the last years is that vaccines are now part of mainstream politics. So they have entered in this polarization, struggling system of partisanship and mutual derogation. And actually, ideology is one of the best predictors of vaccine hesitancy and partisanship, political vote. So to understand the problem, we need to escape from the logic of polarization, I think, and address it with empathy and with mutual understanding, instead of demonization and derogation of the vaccine hesitant. Because many of these people, when you analyze their arguments, they are obviously wrong. Vaccination is the correct decision in most of the cases, but people tend to be reasonable and people tend to be driven by their own psychological motives. So they are not irrational. We just need to understand why are they making this decision. And that is very challenging, especially for physicians, to be trained in empathy and in long conversations. And also, they have a very limited time per patient. And that is also challenging in terms of deployment of this training and this kind of conversations. So yeah, that will be my choice. Training in empathy.
Great, thank you very much. And that sets up, thank you to all four of you, that sets up a really interesting, wide-ranging discussion. I think hopefully we'll get a chance to return to everything we mentioned there, but we'll do our best. Can I start with a point that came up? It comes up quite a lot for those of us who follow public health, a little bit in my last panel. Has health lost its moment since COVID, do you think, and what implications does that have for prevention strategies? The regional director of WHO Europe told me recently that in his experience, global leaders don't really want to talk about health so much anymore, or at least not what involves actually putting some money on the table. In that kind of political environment, how do we secure the political and financial resources needed to do prevention properly on a long-term basis, rather than just jumping from fire to fire, and trying to put them out as they arise? Wolfgang, do you want to start on that?
I think the question if health has lost the political or its momentum at all, also among the citizens, is difficult to answer. I think we should go back and say what is the big lesson learned from COVID, and that is based on the lesson learned from swine flu and based on the lesson learned from SARS and from Ebola and so on and so forth. From Zika. I mean, every couple of years something is popping up. There's nothing new. It's just popping up. There's different spatial or temporal dimensions. So if it has lost its momentum, I don't think so. I mean, I try to be optimistic about it. It might become more difficult in the current, let's say, budgetary situations in many countries, in many areas of the world, to have sufficient funding. But as long as there is a proper prioritization of where funding is needed for. I mean, you mentioned a couple of points on vaccination registries, on things which are relatively easy and not too expensive to implement. I think there is a good case to make for, also at the political level. There is certain things, and Laurent, you mentioned this in the first panel, around research and development. That is an expensive area. But the question is here, how can we identify better financing models to pull the money or the budgets which are needed together to work along priorities and not to work along a wish list. So I think that's, to make a long story relatively short, I think as long as we keep the priorities up, as long as citizens are properly informed, not only by Politico, I would say, but also by other press or by other media that kids and elderly people or just people like me are using, as long as there's proper information, I think there is a good chance that health, at least public health, stays on top of the agenda. At least it's needed, because we are not there where we should be, coming out of that massive pandemic with these disastrous effects across all political topics.
Yeah, Tukumba, what do you think? Are you concerned about waning political appetite for prevention, or are you an optimist like Wolfgang?
Yeah, similar to what Dr. Philip just said, I think rather than COVID giving us the impression that health loses momentum post-COVID, I think COVID really opened the eyes of the world of the importance of focusing on health. And particularly, the COVID really turned the whole world, everyone into virologists. Everyone now simply understood what it means to have a viral infection, how regularly you have to test, the importance of you actually preventing, protecting yourself, wearing gloves. So for me, I think there's a number of things that COVID opened our eyes to, that we can draw on some of those parallels to address some of the infectious diseases that we're talking about on this panel today. So if I focus again for one moment on HIV, what we've seen since COVID is that the face of the epidemic begins to change slightly compared to before COVID. And we begin to see, suddenly, for example, in 2022, we saw real new infections and increases in infection in women, heterosexual women, and in migrant populations. And for us to be able to reach these specific populations, it would require a very dedicated approach. And you would remember that there is a commitment by the EU. Member states made a commitment based on the Sustainable Development Goals of the UN to end HIV epidemic by 2030. So I think there's a real opportunity with this particular legislature, given that this is the last 5 years run-up to that 2030 goal, to really turn the dial on HIV infections and really bring an end to an epidemic. And there'll be a number of approaches that will be required for that. For example, it's been 2016 since we saw an action plan from the EU, member states, as in a coordinated at an European level. It would be very, very, very instructive if we can have an action plan that leads us to the run to 2030, because it's a real opportunity here. Not often do we have the opportunity in an infectious disease to actually end an epidemic. And because we have the tools to be able to do it, I think this really presents us a real opportunity. There are a number of components we could have in such a plan, and I can elaborate on a few of those. We can focus on funding. Philip mentioned about funding and coordination earlier on. We can focus on sharing of best practices. As Marilyn has alluded to, there are a number of things that we've learned from other infections that we can carry over to infectious diseases, and particularly to HIV. We can focus on community engagement. And I think this is an important area that we saw during COVID-19 as well. Angelo referred to vaccine hesitancy, and some of these myths also have been extended into the HIV stigma. So there are parallels here we can draw in really ensuring we're addressing, from a public health point of view, misinformation, misunderstanding, and really normalizing the idea of prevention, that everyone can have prevention and actually can really be able to engage with this fight to end the HIV epidemic.
Okay. Marjolein, is prevention still a political priority in the Netherlands? And what implications does the new far-right-led government have for...
Well, broadly, one can say not only prevention for infectious diseases, but more broad prevention is getting more and more attention in the Netherlands. We have an integrated care agreement from last government, and it's still there. And it was the first time when this was negotiated that all the parties working in the health sector, so also the hospital, said, we need more prevention. So we need money to go from hospital care to the general practitioners and even to the real prevention side. So we were very, being the DG responsible for prevention, I was very happy with that, and I think it was also very wise decision to move. So there is, in general, a different understanding of the importance of prevention. Even our employers' organization made a statement that they want more attention for prevention. However, our new government decided to write down that they think prevention is very important. However, they had to do a lot of budget cuts, so they also cut quite a bit on prevention. So now we are thinking of how we can do the utmost with a little bit less money. So we are more looking now also to the instrument of making laws. So there is a general understanding that prevention in society, also due to COVID, is very important. But this government also did some budget cuts.
Mm-hmm. Okay, but perhaps we can come back later to what kind of new measures you're thinking about. But Angelo, can I ask you about JITSUVAX, the research project you're involved in? Can you explain to us briefly what it is and why is it called JITSUVAX?
Yeah, well, JITSUVAX is a research project is now finishing. We want to extend it, so we have now a very robust set of outcomes, and we have been collecting evidence and developing tools. We have a whole training program now for physicians and nurses to talk with their patients about vaccines. It's mostly focused on vaccines, but we think it can be extended to other treatments or other, let's say, hot treatments affected by disinformation campaigns. So yeah, it's being deployed, have been deployed in 5 European countries, plus Canada. We are now moving to Eastern Europe because the big problem with vaccines is nowadays mostly in Eastern European countries, mostly because of distrust in their institutions and their political system. And yes, we are now trying to deploy the training. We are starting collaborating with the British National Health System. We are going to move to France very soon. It's been very successful. We're still field testing the intervention, and it's based on this idea of empathetic refutations, in the sense that to have a head-on conversation about the specific beliefs of patients, which is something very tricky and is something very sensitive as well, in the sense that you can, if you don't do it the right way, you can trigger reactance and you can have, or maybe you can even lose the argument or make the patient think that they actually won the argument. So you have to do it properly, right? So yeah, we have this set of tools. And of course, it's open to everyone, and if someone is interested in joining us or in supporting our training program, I will be very happy to speak with anyone in this room about it.
I was on the JITSUVAX website, which I recommend you all look at. It's really interesting. But it cites a definition of a jiu-jitsu model of persuasion.
Yeah.
So it says, Jiu-Jitsu teaches that smaller, lightweight fighters can win by using leverage, gravity, and momentum to defeat more powerful opponents. Who is the more powerful opponent in this case? Is science now in the position of like the lightweight fighter up against a more powerful enemy?
Yeah, the idea of Jiu-Jitsu is, well, you know, this is Steven Seagal's vibes, like, to use the strength of the opponent. So in this case, the idea is to use the psychological drivers of vaccine hesitancy in favor of vaccination and not against. Mm-hmm. So maybe you can redirect conspiracist ideation from the institutional healthcare to vaccine deniers, to these organizations, which are actually heavily funded and they have a lot of economic interests. So yeah, I think science is in a position to at least tackle or address this information. But it's not a matter of just showing the data or giving non-empathetic information, but to, as I said, have the correct conversation with hesitant people. Many people are hesitant because of religious motives, because they are reactant to authorities, because they have endorsed conspiracy theories, because they reject expertise, because they are complacent. They think I mean, the thing with vaccines is that it is a and an intervention for healthy people to prevent a disease they have never seen. So people don't, I mean, I have been vaccinated against polio. I have never seen a polio patient. I know it's a devastating disease, but it's easy to misperceive the risk of the disease and overstate the risk of the vaccine and overlook the benefits of vaccination. So maybe if you have that kind of patient, you need to have that kind of conversation. Or maybe you need to talk about the Pope, and the Pope endorsing vaccines, and the Pope is most important than your local priest, right? So maybe you need to have that kind of conversation. And yeah, so it's difficult.
Marina, sticking with the topic of vaccination, what's the situation in the Netherlands? I mean, are there any gaps in vaccination coverage that you're seeing? Where are they, and how have you been thinking about how best to combat them?
Yeah, well, let me say something on childhood vaccination. And if we look at all vaccination for childhood, the national average is 83.1%. However, there is a big variation. It varies between 51 and 96%. And what we see is in certain parts of urban areas and the conservative Christian regions, the rates are lower. And furthermore, what worries us a lot, and I think that is Europe-wide or maybe even worldwide, is that the vaccination rate trend is declining. And we see more decline, more rapid decline in cities among immigrants, but also amongst high-skilled workers. Maybe you can explain a little bit about that. So, well, we see this worries us, and I think indeed it is very true that people now, even parents now, have never seen these diseases, so they do not have the fear for it. So what we try to do is address this by a targeted local approach. As you said, we go into the communities, we involve local leaders, religious leaders, we give information, we are present at local markets, we open more locations where you can go to for your vaccination, but also can go to for more information, etc., etc. So we already had this targeted local approach, but due to the fact that the numbers are lowering, we are putting extra effort and extra money on this. And the good news is that Amsterdam has been one of the first applying this approach, and there we can see the numbers, the rate of vaccination is actually growing. So we're very happy with that. So that gives us a little bit hope that the tide can be turned.
Yeah, I mean, I think we've learned quite a bit during COVID about how vaccine hesitancy is distributed across the population, and which groups are more likely to be skeptical towards vaccination. I did see a paper from the Erasmus University in Rotterdam, where I mean they focused on well-educated Dutch parents who they thought were skeptical, which they found surprising. So. Perhaps, Angelo, I don't know if you find that surprising.
Yes. Vaccine hesitancy is not a phenomenon. It's not essential of people from lower socioeconomic background. It can be found in high socioeconomic, at a high socioeconomic level. Mostly because sometimes vaccines are seen as something for unhealthy people with unhealthy lifestyles, and some people can be very. I don't want to say arrogant about their own lifestyle, but I mean, some people think they're very, very healthy. They have a very healthy diet. They eat very good food, very expensive food. They live in a very nice neighborhood. Everything is so clean. So, well, I don't need vaccines. But yeah, I mean, no one can escape. It doesn't matter how healthy your food is. It doesn't matter how clean your neighborhood is or how privileged you are in terms of being able to work remotely or whatever. You need to go to the supermarket anyway, and you will be in contact with, vectors of transmissions, and you will be, of course, in risk.
Kumbo, I mean, just broadening out from vaccines a little bit, but thinking, I mean, perhaps perhaps Gilead has faced this itself with its own portfolio, like declining trust in science, I suppose. And is that something you've observed? Is that something you're kind of thinking about as part of your strategy?
Sorry, can you just rephrase that?
Yeah, I mean, how does Gilead is Gilead concerned about waning confidence in mainstream science and new innovations, the safety and efficacy of new products? How do you think about that, and is that something you're working on?
Clearly, I think the world still really believes in the science. The science that we have seen for COVID-19, I think, really helps the world to understand that when we tested something in the lab and this is rolled out in the population, it does work. So I think COVID really broadened the understanding and awareness that science rules, and science really is the anchor. So we don't have any concern in that regard in connection to the potency and the potential that preventative options do have. Of course, we should consider combination prevention services, which is, first of all, behavioral interventions, and then the use of condoms, and then the use of biomedical prevention, which is PrEP, and also treatment as a prevention. But your question specifically today is around PrEP, which is that biomedical innovation medicine that you can take and actually prevent acquisition of HIV. Now, as Angelo was alluding to earlier on, it's an interesting concept for you to get healthy people to actually take concerted effort to prevent acquisition of something they've not experienced. Maybe it's very far in their mind. The perception of their risk to it is also very sparse. So when we think of approaches to help engagement in HIV, I think there has to be a public health approach in the way that we've also tackled COVID-19 as an example. If you look across Europe, given the potential of PrEP, the uptake and the impact is still very limited. France would be one of our best examples in terms of uptake of PrEP. And even there, the uptake is between 7 and 28% of those who can actually benefit from PrEP being on PrEP. And there, in many countries, we continue to see increases in HIV infection. That tells us that there is urgent action required. We're sitting today in Belgium, where last year in this country, there were 665 new infections. That was a 13% increment on the previous year. And this is an infection that is preventable. So definitely the science is there. The tools are there. I think we have a role as a collective to be able to put programs in place that allow underserved populations, individuals who need this intervention, to be able to access them in places where they prefer for these services to be delivered to them.
Yeah, we're going to come back to HIV prevention, uptake and access in just a moment. Before we do, Wolfgang, I just want to give you a chance to come in on this if you'd like. We heard so much yesterday about misinformation, disinformation becoming embedded in the political discourse. Just look to the US, plenty of it about in Europe as well. You're the chief scientist officer of HERA. Are you worried that science is sort of facing a crisis of legitimacy and trust in some way? And how do we repair the damage?
It is certainly not easy to communicate these days about whatever you want to talk. Talking about science can be relatively dry and can be relatively, let's say, perhaps not the most interesting thing for many people. But just coming back to the very specific point around vaccination coverage, vaccination or vaccine hesitancy. I mean, vaccination coverage, low vaccination coverage is something which is not new. Vaccine hesitancy is not new, and we are sitting on panels for years and years and years and discussing and describing the causes. So you mentioned you mentioned a couple of activities that you pick up now. I think what would be important is really to move into action. I mean, it's not just the vaccine hesitancy that creates a low vaccination coverage. It is also the availability and the access to vaccines that has an effect, depending on where you are in the world or where you are in Europe. I mean, we see, for example, for something relatively simple, not simple, but I mean, long-lasting, safe, efficient vaccine like MMR for measles, mumps, rubella, which saved millions of lives of babies. I mean, that is very simple, a very simple statement that you cannot counteract. But nevertheless, the vaccine uptake of MMR for measles is relatively low in certain countries. Why is that? And what is being done about it? That's the question. So fixing targets is very important, but then to act is the other thing. Now, coming to communication around science, that is something that can certainly be, I think Bill Gates said once, science is not just for nerds. Science is something that can be interesting, but you have to communicate in the right way, using the right channels to reach, I don't know, younger kids, youngsters, teenagers, middle-aged people and the older people. And these are different channels, and it requires different information, different packages, and that can be done. I think there's a huge field of exploration that could benefit vaccine uptake, trust in science, and also trust in public health measures and trust in health measures once we reach the healthcare setting. So, but it needs to be done in a professional way, and it needs to be done not as a counteract to misinformation coming on, you know, what kind of channels I'm talking about. It's not about counteracting, it's really about being proactive and coming up with the information that is correct, evidence-based, and makes sense so that people believe it.
Great, thank you. I mean, Takumba, I want to come back to this point about HIV prevention. And you mentioned at the start, I think we need, you know, the most important thing we need to worry about is making sure we have incredible products and innovation in HIV prevention. Gilead's been heavily involved in that. We need to make sure that these products get to the people who need them. Why aren't they getting to the people who need them? I mean, you mentioned PrEP uptake, and you know that's an issue, and there's some similarities in the conversation around vaccine hesitancy, I imagine. But don't we also have to think about access and, you know, the price of these drugs as well? I mean, there are, you know, pretty severe inequalities in access to HIV prevention drugs, and I guess I suppose Gilead has to sort of take its responsibility for that. Is there something we can do on the access front as well?
Okay, you asked a number of things in the same question, so let me try to unpack this a little bit. No, that's fine. You made the point that inequalities in infectious diseases, particularly with access to PrEP, is an issue. That is right. You would remember it was Paul Farmer who said infections track along the lines of inequalities. So what we've seen definitely is that some populations are more impacted than others, and that requires some attention. But the issue around equitable access would also require some concerted funding, but also innovation in the different funding mechanisms that we consider. For example, here is an example. Dr. Philip is present here on the stage. As a commission, the EU took a very different approach to really purchasing and acquisition of medicines when we're looking during the COVID pandemic. Definitely, there's a role for pharma in terms of innovation, in terms of we have medicines that can really address prevention. But there's a role also for the government in terms of investment and thinking of the appropriate funding mechanisms so that these innovations can reach the individuals who reach them, who need them. Of course, we as a company, Gilead, we're concerned about access. We have global access programs. We have access programs also within Europe. We also have specific areas where we invest in testing innovation, in initiatives, in really looking for models of care that allow disproportionately impacted populations to be able to engage with care in the settings where they need them. So we work at community level with community-based organizations, with healthcare institutions, doing implementation science, doing research in these communities to understand what for them are the triggers that would help them to engage more with preventative services. What are the things that preclude them from engagement? What settings, be it healthcare or social care, do they want preventative services to be presented to them? We realize that these populations, these communities don't normally engage with mainstream healthcare. And so our contribution as a pharmaceutical company is not just to produce the drugs, but also to understand the mechanism on the ground so we can partner with government, with policymakers, with healthcare professionals to put in modalities that really closes the gap in terms of engagement and access for vulnerable populations. Mm-hmm.
And no, for sure. But would it not also be fair to say that many people in lower income countries, middle income countries, don't engage with mainstream healthcare because they can't afford it sometimes? And some of the, you know, these are very expensive, very incredibly effective drugs, very expensive drugs. and there's often significant gaps in access. I mean, does industry in general have a commitment, have an obligation to ensure affordable pricing, access? Should that figure centrally in any good prevention strategy?
No, absolutely. That is critical. And that's one of the things we're most proud about as Gilead. You may not be aware, but Gilead was one of the first countries to really commit to the medicines patient pool. Mm-hmm. And today we have given voluntary licensing to over 150 countries in the low and middle income countries, allowing for access to generic versions of our medicines to be able to reach the populations most impacted. So this is something that we're really committed to. It's our DNA as a company, the access. But I think what I want to draw attention to for this moment, and here we're sitting in Europe, is that the last data we saw from ECDC showed us for the first time the new infections outside of sub-Saharan Africa now exit new infections in sub-Saharan Africa. So that tells me there is something we need to address here on this continent. Not just on this continent, I mean everywhere outside of sub-Saharan Africa. But today we're in Europe. There's a specific need here. We as a company, as industry, we have a role to play. But we're calling upon every single person here in the room as well, and outside of this room, around policy, around investment, around funding specifically for preventative options. I think there's a real opportunity here to really be able to end the HIV epidemic by 2030. I think we can do it.
Absolutely, and as you say, I mean, Winnie Byanyima, the UNAIDS Executive Director, did say in October that 41% of new HIV infections occur in middle-income countries, and that the burden is really shifting outside sub-Saharan Africa. A testament to the work that's been done in sub-Saharan Africa, also persistent access issues in Latin America, for example, which were not included in the generic licensing agreements. But it is true that Gilead, in October, I think, if I'm not misremembering, granted licenses for generic production, although civil society is concerned that the coverage doesn't extend far enough. But that is a major step forward in access, absolutely. I think we should have time, if we go around, maybe everyone should get about 30 seconds to respond to this one. With respect to, you can focus on any particular issue that we've been thinking about, but I'm thinking about the overall situation on prevention. Are we in a better or worse position than we were before COVID, do you think? Angelo, do you want to start?
It depends. I'm a philosopher, so I will say it depends. That's what philosophers say all the time. But yeah, I think we are more aware of the challenges of our postmodern, post-truth world in terms of disinformation, social media, complacency, polarization, inequalities, or any other problem we have now to deploy public health interventions. We also know we need we have a gap between continents, between regions. We need to close that gap because public health is a global issue. And something, for instance, I see in the scientific communities that we need to get out from the Western European bubble and start conducting research in lower income countries because, I mean, they don't have the money. We have the money. So we need to start understanding and we need to be generous and start conducting research in these other areas of the world because we are also affected by what is happening there. And I think that is very important. We need to find some ways to get out from political polarization and affective polarization. We need to stop hating each other because that is also affecting public health.
Marilyn, what are we?
Well, I would tend to say we're better off. I think the COVID period taught us a lot of lessons. It helped us with getting new innovations, which we can elaborate on. I think the population in general has more understanding of the dangers of an infectious disease and that we need to be prepared. So to keep it short, because that is what you asked for, I would say the glass is half full.
Kumba,
I
do you agree?
tend to agree as well. I think the glass is half full, which of course presents an opportunity to completely fill up the glass, of course. So definitely I think there is an opportunity here broadly for infectious diseases, but specifically for viral infections, because COVID-19 opened the eyes of the whole world to the importance of actually preventing and protecting yourself against viral infection. So I think given concerted effort with those stakeholders, we can have an opportunity that COVID-19 has presented in front of us.
Wolfgang?
I say the glass is more than half full. I think we're better off because at the end of the day, there's a better awareness in public. There's a better awareness at political level about the benefits of prevention. There is more players now active at a global level, but it's a matter of time now not to lose the momentum in implementing the programs in an efficient way so that at the end of the day, we all benefit of all the programs running now. May it be detection down to deployment of whatever is needed, including strengthening healthcare systems. I will not go through the whole list, but at the end of the day, it's a good momentum. We should keep that running with the existing funds and financing.
Super. Thank you all very, very much. We're out of time, unfortunately. It's coffee break now until 11:45 a.m. Good chance to interact with the rest of the audience. Our partners will be waiting for you in the networking area. We'll be back here at 11:45 with an insightful panel discussion on antimicrobial resistance. That'll be moderated by my colleague Claudia Chiappa. Please give a big round of applause for our panelists. Thank you.
Thank you so much.
Can I have your card? Because I'm